We have a huge capacity at WHO through various clusters and groups working on various aspects of cancer. Cancer is quite a special case of a health condition which is determined by many different causes and is then expressing itself as a large variety of single diseases. So we have causes, diseases, and we need a health system in place to fight against cancer. And at WHO, I'm working in the non-communicable disease cluster, where we are very much determining the agenda, the global agenda, to put NCD on the agenda to fight against tobacco and risk factors. We have other clusters working with health systems and essential medicines, reproductive health, vaccines, a lot of groups in WHO, and I'm trying to catalyze that we all, as WHO, one WHO against cancer, work together no matter where we are in an organizational group. So the model to fight against cancer, I would try to develop at WHO, but not only as a WHO model of new WHO reform, how to work together, but this is something where others can take up in the government to work across various sectors, traditionally working not together, like vaccines, reproductive health, NCD. And this is where we want to go, is to have a health system platform for delivering cancer. UICC is our official partner, and for decades we have an official relationship between WHO and UICC. So we do a lot together on advocacy. We are working together on these major meetings, the World Cancer Congress, World Cancer Leaders Summit we have organized together, where we see both bringing together in a complementary way our key stakeholders, means the governmental, the non-governmental, civil society, private sector, patient groups, and it fits very well, UICC and WHO. Vaccines is an interesting topic because cancer is in part caused by infectious causes. That we know that a chronic infection at the long run, like hepatitis, human papillomavirus, Helicobacter pylori, can cause cancer. So traditionally this is a communicable disease condition which can be controlled by communicable disease interventions. So we, from the NCD and cancer community, can learn a lot from our communicable disease colleagues. And this, I think, is a magic bullet for working together between WHO and Gavi in order to increase access to very simple interventions to break this transmission by a vaccine. The vaccination against cancer is a fascinating field, and I'm very, very excited about that. Liver vaccines is important. Vaccines against liver diseases. And I know from my personal history, I'm a medical doctor, I know that in the 80s when the vaccine came up against hepatitis B, it was very expensive, and even in Germany where I grew, where professional in hospitals, only few got the vaccine, the medical field, because it was extremely costly and extremely expensive. And now hepatitis B vaccine is very low cost, very cheap. And this because there was a huge movement around the world to implement HPV vaccination through an alliance which is called the Gavi Alliance. And this has done a huge progress in the fight against liver cancer in many parts of the world. Similar has happened to another vaccine which was invented 10-15 years ago. So we know not only liver cancer is caused by a virus, but also cervical cancer is caused by a virus, which is called human papilloma virus group. It's a series of different subtypes. And 10 years ago, it came up that there is a vaccine against this HPV infection, active, very effective, and over the last 10 years we at WHO developed all the guidance which is needed to introduce HPV vaccines. In the beginning it was very expensive, and now that Gavi has put this in the portfolio of Gavi, for Gavi eligible countries, for very low income countries, the price is falling very rapidly.